The following is a production by Lone Star Community Radio, Montgomery County's community radio station. You can support Lone Star Community Radio by donating and sponsoring programs just like this. For more information, check us out online at irlonestar.com. This segment is brought to you by
Team Sinisi is a proud sponsor of Conroe Culture News. Vinny Sinisi and his professional team provide comprehensive real estate services throughout the greater Montgomery County area and beyond. Whether looking to buy, sell, or invest in real estate, Team Sinisi has an impeccable reputation. Contact Team Sinisi for a great experience at teamsinisi.com. That's TEAMSINISI.com.
Since 2004, Roger Stein Chiropractic has offered spine and joint manipulation services to residents of Montgomery County and surrounding areas. Conditions treated include lower back pain, migraines, headaches, whiplash, carpal tunnel, neck pain, sciatica, joint pain, sports injuries, herniated discs, and complications from pregnancy. Roger Stein Chiropractic, led by Dr. Stacy Rogers and Dr. Brian McGee, is an integrity-verified chiropractic clinic. Call 936-441-9990 for an appointment or visit rogerssteinchiropractic.com. That's RODGERSSTEIN chiropractic.com.
You are listening to Lone Star Community Radio on 104.5 KCZWLP Conroe and 106.1 KZCCLP Conroe and worldwide on irlonestar.com.
And I am sitting here with Rita Wiltz, a good friend of, gosh, how long, Rita? It's been a while, right? Over 15 years.
Oh, I was thinking more like 5,000 years.
I'm not 5,000 years old,
Okay.
but thank you, and neither are you. And you look fabulous, by the way.
Thank you.
But
So do
Rita
you.
does so many things with Children's Books on Wheels. Of course, she promotes literacy and gives out books all the time wherever she goes, at different fairs and food drives and different things. But right now, she's here to talk about the open enrollment for healthcare, correct?
Yes, the healthcare marketplace is now open. Last day to enroll is January the 15th of 2022. It's important that you have access to coverage, and it's also important where you get the access to coverage and the assistance that you need. Children's Books on Wheels provide those services in English by our community health workers and also by our promotoras, which provides services in Spanish. So we want to make sure that our diverse community in Montgomery County is serviced in every way. So those services are available to help you, virtual, online, or you can call us.
So explain a little bit more about the open healthcare enrollment. What is different about all of this, and why is it important? How is it different over the many years? Because you've been doing this for 10 years or so at this point. So sometimes it's been a little tricky for people to understand and navigate the system. So what are some of the differences from the years gone by?
So when the Affordable Act first was executed, services were provided to families that had special needs as far as trying to find a service and then also find an affordable service. And that's why it's called the Affordable Health Care. So healthcare marketplace navigators, they go through the proper training. I must admit that it is quite intense, but that's okay because we want to know what we're doing. We want to make sure that the services that we provide, we do have a background check because you are giving your personal information. For people just to call you and you start giving information and you don't know who they are, you want to make sure that they're qualified. So we are registered vendors for the federal government and also local. So with the local services we provide, the CHIP, the Medicaid, and food stamps. Also along with that, you have families that they're in the gap. You know, they don't have insurance coverage from their companies. It's too much, they can't afford it, or they have a previous health condition. And now what we're dealing with is families that have previous health condition caused by COVID. That is a previous health condition. And so,
So,
with that,
hold on just a second. So you're
Okay.
saying pre-existing conditions.
Pre-existing conditions.
And with COVID, a lot of people had COVID even in our community. So you're saying when they go back to their insurance, that seems to eliminate them from getting insurance where they work. Is that true? I'd never heard of that.
yes, because it also affects the whole family. A lot of time when one person is affected by COVID in the family, then usually the rest of the family gets it or they're exposed
Sure.
to it. And if you had an underlying health condition, let's say you have COVID, then you are a diabetic, you suffer from hypertension, all of those things are underlying conditions. And so with that, it makes the COVID even worse as far as how you breathe, how you move around and about. The other thing about it is that when the children are exposed, that children that have a disability, they need access to extra services too. It's affordable now. The healthcare marketplace navigators can actually walk you through how to enroll. It covers 13 essentials. So I want to tell you, a lot of people really don't know what it covers. It covers health plans that cover vision, dental, medical management programs for specific diseases or condition. It also covers the essential health benefits, which are 13 coverage of doctor's visits, prescription, hospitalization, pregnancy, and more. The rest of what the service provide is you compare plans. So you can choose a plan that's affordable for you. You can choose a plan that's affordable for your family. A lot of times with veterans, they're covered through the Veterans Administration because they have service, but then their families don't qualify for that service. So we're able to help those families to find the right services and the insurance companies for them. We can also help them go through to find if that particular doctor is covered by a particular plan, if your prescriptions are covered, because a lot of people take a lot of different prescriptions, and with those, you want to make sure that they're covered and have access to health care. There's no reason anymore not to have access to health care, and our services are free. If someone's inviting you to come in to help, or you give them access to your personal information, and then they charge you, then that's not a healthcare marketplace navigator. That's not even a state navigator, which are the other services that we provide for the state. So Children's Books on Wheels, we are federal qualified healthcare providers. We also are part of the state to help families sign up for services local. We're at different locations throughout the county. We provide services at Children's Books on Wheels. We meet with the families to make sure that they have everything they need. And with the same type of coverage they're available for, then there are other things that goes along with this. When it's time to do your income taxes, your 1095s, and making sure that, you have the information that you need for your income tax. So that's another services that they kind of go hand in hand to make sure that you have the very best coverage that you can get. Also access to services with the tax because of the premium tax credit. So the premium tax credit, a lot of times people don't understand what it is. Would you mind if I tell you about the premium tax credit?
No, sure, absolutely.
So the premium tax credit, when you go in and you are looking for a carrier, you're putting in your insurance information, how you decide who you have insurance with based on your income. So your premium tax credit is the credit that you would get for your income taxes when you would file. So they take a quantitative amount of how much you make a year, divided by 12 months, divided by how many people in the household, divided by all the things that goes along with your household, and then that is your premium tax credit. You can use a part of that tax credit to pay for your insurance premiums every month.
Oh, that's interesting.
So
Yeah.
that's a premium tax
So
credit.
you help people with that to figure all of that out when they register, enroll for the health care.
Yes, we do. We've been providing the services for a long time, and we give the very best that we can give. And a lot of times when people associate Children's Books on Wheels with services, because it's free, a lot of times people say, oh, it's free. No, it's a quality service. When we're providing services for the state, when we're helping families that are in undisclosed location that need help for the women to qualify for services. For the first time, this woman is in charge of her finance. For the first time, she's in charge of making sure that the family has insurance coverage because the abuser had the insurance the whole time. So therefore, we help the survivor. She's not a victim, she's a survivor. So we help her with those services. We also provide services through other organizations, resources, and referral services. We're all around Montgomery County. We're in Walker County. We provide the services to people that reach out to us. We're also qualified to provide services in another state. So we've been doing this for a long time. The services are at no cost. It is a quality service. And it falls on our healthcare literacy component that we provide services, the same way we provide services through Susan G. Coleman, the HIV/AIDS and awareness, the financial literacy piece where we provide free tax services, and then the digital component where we have families that don't have access to computers, and then the educational component where we make sure that children have access to books and working with the schools. So it's a wraparound service that we provide so that the families also have access to training, certification through OSHA, through Project Fuel, and making sure the mental aspect of it is taking account of. So we have an all-around service that we provide to families, our volunteers, our board members, our healthcare marketplace navigators. We go through a federal background check, and we also go through a state background check to provide services.
So you're very thorough. How many navigators do you have?
We have access to subcontractors 20 at a time.
So if somebody were to call or text you to arrange, they might get you. They might get one of your other people affiliated with your organization to help people get the assistance they need.
Yes, we do. And we also go into different events. Yesterday we were out in East County up in Cleveland, and they needed someone to provide services. Well, it was you visit with Santa, and you have access to different, they had hot chocolate, they had other services that were there. But we were there because we found out a lot of people can't get around in Montgomery County. As you know, one of the top 5 issues of Montgomery County is no public service. Yeah. So you need services that come out to you. So we come out to provide those services there. We're at Community Assistance Center. We'll be at the library. We're inside the school districts. We're working with other families. We work with Meals on Wheels to provide services. We're at apartment complexes. We're at other nonprofits.
So the best way to find out is to follow your Facebook page or to text or call you, right? To find out where you're at. So your phone number to get an appointment to help with enrolling in healthcare services is 281-844-7596, right?
Yes, it
Call,
is.
text, whatever, and you will immediately help get them on the schedule.
Yes, we will. And we have a turnaround time of 24 hours of calling everybody back. And again, we also have those services provided by our promotoras, healthcare market navigators. So the services are provided in Spanish. We also have other translators that work with us that have had a background check. So whatever the language, we make sure we provide services. And we hang in there with them until they decide what they want to do, how they want to do it, and walk them through it. They actually have to enroll. They actually have to set up passwords, access to the services.
How long does this whole thing take to help them with this? What kind of allotment do they need to allow?
We're looking for an hour.
An hour. Well, that's pretty efficient. So do they need to bring anything with them, any resources with them to help them sign up and enroll for the health care?
Yes, they will need to bring a photo ID. They would need to bring, if they're registered to work in the state of Texas, have work permit, we need those type things. If they have passports, we need those so we can enter the information and help them load the information. They also need the Social Security card of the family members that they want to use so that it can be verified. And we'll also help them set up a password. So we're efficient in the way that we do it. We're compassionate in how we provide the services. And we also care about our clients and people that need help. A lot of people that are homeless qualify for a lot of the services because even though they're homeless, they still have an address, at different service providers throughout the county.
That's a good idea. Yeah.
And then that way, and then they have a little bit of income coming in. So, no deductible, zero deductible. You can see a specialist if you would like to. a doctor. We also work with the Lone Star Family Health Center to guide families
You work
there
with
that
them a
need
lot.
services. So it's a wraparound service, and I know you keep telling us all the time we should change our name to Children's Books on Wheels and more, and then some, because of the services that we provide. But there is a need in Montgomery County, and it's rural. You can't get into us, but we'll come out to them. Red clay, dirt, mud, wherever you are, whatever
Wherever
you
it
need to
is.
do, we'll provide the
So,
services.
Again, that number is 281-844-7596. They can also go to your Facebook page, Children's Books on Wheels, and find this information with the contact information. And your website, of course, is children'sbooksonwheels.org. Mrs. Rita Wiltz, call her, text her, get involved. She's all over the county, and that's the best way to get it done. You need to get it done before January 15th, 2022, right?
And our navigators, yes, 2022, 15th of January. And our navigators, they will have PPE, so, they'll have the mask, they'll have the hand sanitizer, so you don't have to worry about that type of environment. We make sure that we're very careful in how we provide services and how we provide for the next client that is seen after them. So all the consumers are safe.
Thank you, Rita. We appreciate this great information. And if you don't have health care, you need to sign up and get it. And if you sign up now, doesn't it go into effect as soon as possible, or when does it go into effect?
30 days after signage.
Okay. All right. So get on it, people. Let's go. Healthcare is important, as we know, as we've seen, right?
It definitely is, and access to service is not a problem anymore, and that's why it's called the affordable health care, because it is affordable for all families. We'll help you decide. We'll help you decide the way you want to do. We don't pick a plan for you. You pick it for yourself. But what we do is let you know what's available so you can decide what's best for you and for your families. If your student is away in college in another state, we can help you with that also.
Okay. Well, thank you very much, Rita. It's always a pleasure to see you. Have a great time with your family in the next couple of weeks.
Thank you. Thank you so much. I appreciate it.
Bye.